We did genome analysis in 110 cases. In 106 cases, no L452R was detected. 4 cases with a viral load too low. We had 12 imported cases, 10 positive through PCR, 2 through RAT. They are positive cases. 5 arrived at Hong Kong yesterday on 2 passenger flights, 3 on CX252 and 2 on SQ882. The remaining 7 cases arrived at Hong Kong earlier. They were detected on day 3 or day 5, and 3 cases on day 12. But in end March, they were positive overseas with a CT value of over 30, quite high. So it was just the virus residual. We do not have any new care homes reporting cases, but for existing care homes, we've got 10 new cases involving 3 RCHGs and 1 RCHDs. No staff member was involved. Yesterday, I reported that in schools, there were 19 cases affecting 19 schools. I need to give you an update. One more student from one of the schools. So that is 2 children in the same family are studying in the same school. So we counted one less. So in total, there should be 20 positive cases from 19 schools. We have more schools resuming face-to-face classes today. We have 13 new positive cases reported to us by schools, 11 positive through RAT, 2 tested positive through PCR. So 13 schools in total, 1 student from 1 school respectively, and 10 students and 3 teachers are affected. For the 11 positive cases through RAT, 9 were 9 tested positive today, and 7 attended school yesterday, and 2 just started school today. And the last day of school for these 2 were in January. 2 tested positive yesterday at night because the subject did not feel well, and 1 starts school today and tested positive by RAT and reported to us. For the 2 positive cases through PCR, they included in the imported cases 2 teachers returning from overseas and tested positive on day 12. So it's likely that they have the residual virus with them because they were positive at the end of March overseas. 7 more death cases have been reported by HA with tested positive within the past 28 days. So in total, including those not from HA, there are 69 of them. So in the 5th ring, we have 9,061 cases in total. Among the 9,061 cases, 3,737 female and 5,224 male. The gross death rate 0.76%, very similar to the level last year and yesterday, and the analysis again is very similar to what we had yesterday. A total of positive cases by using RAT, 447,911 cases. That's all from me, Dr. Lau. The situation with HA. We have 1,868 confirmed patients being treated in public hospitals, North Lantau ICC, HA Infectious Disease Center, and also a treatment center for COVID-19 AWE. 2 more cases, 2 more critical cases were reported, 3 in serious conditions, and 16 critical patients being treated in ICUs. 7 death cases were reported. A 91-year-old man passed away on the 24th of April. 6 passed away yesterday. 1 male, 5 female, aged between 75 and 96. For the 6 who passed away yesterday, they were all senior citizens over 65 years old. 4 came from care homes. 3 had no vaccination record. 2 had 1 shot. That is, 5 of them had not been fully vaccinated, and then 1 had only had 3 jabs. Another 255 patients recovered and 151 discharged. So far, 41,135 have recovered and been discharged. Since early 2020, 59,515 patients have recovered. 4 patients tested positive during admission screening or testing, and 10 patients in the same ward are classified as close contacts. So far, 22,296 staff members tested positive. 21,722 have resumed duties. Q&A, so please use our microphone and identify the organization you represent. The lady in a white jacket over there. I'm from Now TV. We're told that 7 students tested positive, have attended school. Were they all from different schools? Any students classified as close contacts? Did they engage in high-risk activities when in school? Do you think that they were infected in schools? Regarding the number of patients in home isolation, the CE said that some of the isolation facilities may close down. Given that we have a surplus of places as isolation facilities, why should people be isolated at home and not at these facilities? And as reported, some students are asked for taking the examination at Penny's Bay isolation facilities. I'd like to know whether they attended other examination venues yesterday. If so, can you let us have the venues? And if so, would candidates attending the same venues be at risk? Well, the 7 student cases are from different schools. Now, we require students to do daily RAT because we still have cases in the community. So a student tested positive should not go to school to avoid transmission in schools. And so far, we do not see any transmissions in schools. Of course, we will keep in view the situation. In all cases, on the platform online, we will ask whether they are high-risk persons, including themselves or family members, or whether they are those who cannot take care of themselves or the home environment is not suitable for home isolation. So all high-risk persons will go to community isolation facilities. For the remaining patients, if suitable, they will stay home for isolation.
So detailed information concerning the students taking DSE, for those who are in Penny's Bay, generally speaking, they have to put on mask, and we do not believe that the students who are in the same center are close contacts. The one at the back. I'm from Hong Kong 01. Yesterday, a Nepalese woman arrived, and she was tested positive on the 12th day, and she was found twice positive in 3 months. Did she contracted the illness locally, or was it an imported case? After school resumed face-to-face teaching, there have been positive cases reported. Are there any chance of outbreak at school? With regard to the imported case yesterday, we are waiting for genetic analysis before we can provide the details. Though there was infection overseas, she did remain in the community locally for some time. The level is lower than the residual cases. We also have some patients who have low CT values, and sometimes it will become higher. We're not sure whether it's a relapse. We just treat it as an imported case for the time being. With some more social activities, there are cases in the community. There's a chance of spreading at school. We therefore hope that teachers and students in the coming days and months will continue, days or weeks will continue with the RAT in order to stop spreading. And the next one, the gentleman over there. Yes, I'm from TVB. We've seen that the situation is getting normal. Why can't you start contact tracing? When will you resume contact tracing? As for isolation and triage, will there be any adjustment? Will there be introduction of containment measures? There are also relapse cases. Will you consider the cases of a circuit breaker for the airlines? As for the vaccine pass, the purpose is to encourage people to receive vaccination. You're about to achieve the target. There are considerable numbers who have the second and third doses. There are suitable protection. Will you therefore abolish the vaccine pass and people just carry the vaccination record for checking? With regard to the situation, if you compare with the previous waves, the peak was only 100 or so cases, but now we still have over 300 cases. So it's still a high level in comparison with the peak for this wave when there were tens of thousands of cases. That, of course, the present situation, of course, is a smaller number. Now, we have been doing contact tracing to a certain extent. In respect of high-risk places such as care homes, schools. We also analyze whether there are high-risk spots. We need to study the situation. As for the circuit breaker for flights, we have to consider how we are to deal with the relapse cases. As for vaccine pass, I do not see any need for abolishing it in the near future. After all, people do eat out, and restaurants are high-risk places. People have to remove their mask when eating. The number may increase in the future. So for those who have received vaccination when they go, they better receive vaccination before going to these places. Yes, gentlemen over there. Yes, I'm from the cable. TV. You are doing contact tracing according to Dr. Chang. Can you disclose high-risk cases to us? As for isolation facilities, what is the usage rate of the facilities? The CE this morning said that some community isolation facilities have been suspended for use. Where are they? What facilities are still being used and what isolation have been suspended? And sorry, one more question. There are two imported cases. They are teachers. Do they come from different schools? Yes, they come from different schools. We focus on high-risk premises, such as care homes for the elderly, the schools. We monitor the situation. For buildings with more cases, many cases, we issue compulsory testing orders or notices. What's the next question? Community isolation facilities. I don't have the details in hand because they are not looked after by us. I don't have the usage rate in detail. As for residential homes for the elderly, they are high-risk spots. If we have found new cases, and if they have a large number of cases, then we will visit them. And the close contacts will also be sent for isolation. The lady at the back, in the last row. Yes, there's a decline in the number of cases. The CE said that by the end of May, there will be relaxation of the restriction measures. How do you assess the risk of a rebound? Are there indicators? And when you relax social distancing, do you need to wait for the number to become double digits? As for the cases reported at school, is it within your expectation as far as the number is concerned? Do you expect that there will be a rebound in the number of cases from schools? As for AWE, how many are staying in AWE facility? With the decline in the number of cases, mainland medical staff will stay in Hong Kong for how long? Well, for relaxation of social distancing measures, we have to be careful and watchful. We do not have a specific indicator as to how many cases has been reduced, and we will relax the measures. There are community cases in the community. To students, teachers are living in the community. When they go to school, they are positive. There is a risk. So at present, the level at school is lower than that in the community. With more school opening, there may be more cases, and therefore students and teachers have to test every day. But those who have a high virus load, if they go to school, they may spread the disease at school. If we discover that that is spreading at school, then we'll follow that up and deal with that. In the AWE facility, there are about 60 patients. At the beginning of the fifth wave, we are short of medical staff and also space. So mainland medical staff have helped us a lot. They have provided the most needed support and help. We thank them wholeheartedly for helping us out during our difficult time. As for the arrangement for mainland medical staff who are working, helping us out in Hong Kong, we will talk with the relevant departments concerned, and the administration will report to you on the detailed arrangements in due course. And from AM 7:30, with regard to school resumption, how many schools have resumed face-to-face classes? Among the dozen or so schools, did they have previous cases reported? Are they related then? After resumption of school, have students or teachers been regarded as close contacts and sent for isolation? Now, there are 3 cases of relapse on the 12th day. Where do they come from? Are they local cases? Have they, what kind of virus strand? Is it Omicron? The contact tracing is being done, as said by Dr. Chuang. In comparison with the 4th wave, it seems that the present approach is different. With regard to the 5th wave, with regard to contact tracing at school and at RCH, how are they different from previous arrangements? As for suspected local case, which is now regarded as imported case, are there any difference? Why do you first designate that as imported case first?
The 3 cases tested positive on day 12, one from Indonesia, one from South Africa, the last from Singapore. So in their own countries, they tested positive at the end of May, and then they returned to Hong Kong. So we defined that as an imported case because for all imported cases, we will do a full genome analysis as far as possible to see whether we have a new mutant or variant. Because of local cases, we won't be able to do genome analysis for a lot of them. Once a case is defined imported, then we can be more vigilant. The dozen or so students tested positive today. I recall that for one school, there were 2 students. Well, two students yesterday tested positive were from the same school. Today, one. But then the two students tested positive yesterday had never attended school since January. And for the case tested positive today, the case was not in contact with the two positive yesterday. Our intention is to lower the severity and to prevent outbreak in high-risk places. So for elderly care homes, should there be a new case, we will isolate the case and send all close contacts to quarantine. So very much the same treatment. And for community cases, we'll rely on the online platform to identify whether they are high-risk persons and also quarantine their household contacts. The number of schools resuming face-to-face classes today, well, I've got 617 schools, but I'm not certain whether it's accurate. Next.
香港電台
I'm from RTHK. There are 3 teachers tested positive today. I'd like to know whether they have taught any class yesterday and how many students have they contacted. Are you worried that with more school resumption of classes, there may be cross transmission within schools? So do you have any indicator for school suspension when it comes to the number of cases in students and teachers? Now, we still have cases from RCHEs. Does that mean that you haven't intercepted the transmission chains yet? And do you expect when we can have all the social distancing measures lifted? The 3 teachers, they are isolated cases. So we have to observe whether there is any transmission. And that's why we said that in the particular school, when there is a certain percentage of cases, then perhaps it is not a community transmission case, but outbreak in a school, then we will consider taking action. As for elderly care homes, we are still seeing whether there are particularly high-risk factors in some elderly care homes, leading to still further cases. But in some care homes, perhaps they were doing PCR administered by SWD. Some of them might be repositive cases. So they were not detected previously, but with very high CT value. So we will proceed with caution and then look at the close contacts of elderly homes and send them to quarantine. I don't have any timetable for total lifting of social distancing measures. Next, the lady there. I'm from HKET. For the 13 cases involving schools, I didn't quite get you. I'd like to know the number of cases that have never been to school. So yesterday, there was a school with 2 students. Does that mean that for that school, it has got a total of 3 students, 2 have never been to school since resumption? Well, one has. And what about the 2 teachers? Have they ever attended school? And then for AstraZeneca drug, I'd like to know whether you've started using that and how is it different from the vaccine itself? Among the 13 cases involving schools, 8 tested positive by RAT. They did attend school. And for the rest, it was just the start or just a class resumption. For the 2 cases positive by PCR, yes, they attended class on the 25th of April, but they were probably positive cases. 190 doses of AstraZeneca drugs have arrived in Hong Kong and sent to hospitals for prescription. This AstraZeneca AstraZeneca drug cannot replace vaccination. Now, when we are vaccinated, we'll develop antibodies. Well, our white blood cells will have memories and can very quickly attack viruses. But for AstraZeneca drugs, now if for whatever reason a person is immunocompromised for taking anti rejection drugs, so for these persons, even after vaccination, their level of antibodies is not as high, but the AstraZeneca drug will be injected into the body, and it can be there for about 6 months. And in the unfortunate event that a person is infected, then the antibody will help to kill the virus to prevent the patient from falling seriously ill or even death. Now, I think the first thing for people is to be vaccinated first to create antibodies. We will select those with very poor immuno capacities. For instance, those that have received stem cell transplant. So even after vaccination, their level of bodies is not very high, and they will be injected with the AstraZeneca drugs to give them more protection. Next. Good afternoon, I'm from Mingpao. I'd like to ask about the situation with schools. Starting from class resumption, how many schools have reported cases to the CHP? How many schools have got more than one case involving either teachers or students? I'd like to know whether there are schools that have reported cases to you on consecutive days. Do you suspect any outbreak in any school so far? For imported cases that tested positive on day 12, how many such imported cases has the Center for Health Protection received tested positive on day 12? How many of these cases has the Center for Health Protection found their recovery record overseas? So much so that you consider them positive cases. Now, for the use of AstraZeneca antibody drugs, we're told that they'll be administered to those with poor immune system. I'd like to ask, whether, for the number of doses arrived in Hong Kong already, how long can they last? And can you tell us the latest figures for the administration of the oral drugs?
In the cases reported in the past few days, altogether 47 such cases. The majority of them are one student from one school. Some journalists have asked before you whether there is one more student from a particular school. Concerning the 20 cases reported yesterday, 2 students from one family. They are positive. They have not attended school since January. Today, at the same school, from the same school, there is one case reported. The student has attended the school, but the student has not met with the other students infected. And we have not seen any spread at school. From the 1st of April until now, there are 9 12-day cases. The majority of them looks like relapses. In one case, we are not sure whether it is an imported case. We did the complete genome analysis. The CT value was low. After the genome analysis, full genome analysis, it is similar to the strand in the community, so it's regarded as a local case. Sorry, speaker's not coming through. We have to trust information provided by patient. In overseas, they may did RAT, they did their own isolations, they had a negative report, and then they came to Hong Kong. They said that we have 190 odd AstraZeneca antibody doses in Hong Kong. Experts' advice is that they should be used for those immunology compromised or immunocompromised. Our experts will continue to monitor the effectiveness and also side effects of the drug, and then we will decide whether we will purchase and keep more such drugs. As at the 25th of April, we have prescribed 27,500 the antivirals Molnupiravir, 17,800, and then Paxlovid, about 9,780. Any further questions? If not, then that's the end of the press conference. Sorry, speaker is not coming through. The 12th day, test on the 12th day. One from South Africa, the other from Indonesia.